Nice to be here, and I will just to let you know so you can prepare yourself to actively participate, although there are quite a number of you, but that's okay. We'll have a 10-minute experience of an art therapy session, which doesn't require fabulous art skills. It just requires a willingness to use art materials and reflect for a couple of minutes and make an image that the members of the group will then be invited to respond to. Okay, so keep that in mind. It's always really useful to have a direct experience of art therapy. Okay, so art therapy, first of all, art, of course, and all definitions of art are going to be contestable, they're variable. So I sort of liked this one from Wikipedia, that art is a diverse range of human activity and its resulting product, and it involves creative or imaginative talent or ability, and generally there's an expression of technical proficiency. It can come in quite handy. Beauty or aesthetics, merely formal considerations, emotional power, and also conceptual ideas. So it's informed by art history and art theory and our social existence. So keeping that in mind, art therapy, there's roughly three types of art therapy. The art therapy that we're going to be doing today, in a really, just a little taster, just tipping your toe in a little bit, is a little mini experience of art psychotherapy. So art as therapy, so just using art materials, oil pastels, crayons, paints, clay, cooking, gardening, sewing, they're all inherently therapeutic activities that involve making. And it doesn't have to be good, doesn't have to be informed by any particular theory. It doesn't need to have aesthetic qualities, although if it's food, it usually needs to be edible. Therapeutic art, again, doesn't require special training. And it's the art that we make in a journal, for example. So probably all of you are familiar of artists' journals, and that's the raw stuff that sometimes gets just vomited out onto the page, sometimes almost literally. And that can be a really therapeutic process. It can be the basis for making art, but in itself, that vomit onto the page isn't actually art, although it can feel great, be cathartic, contain wonderful little seeds of ideas to explore. So art psychotherapy does require facilitation by a qualified art therapist. And in art psychotherapy, I invite clients, participants, to use a range of art materials. So we've got a range here, textures, oil pastels, chalks, to express thoughts and feelings. And some of us feel so much better, much more comfortable, relaxed, expressing our thoughts and feelings using art materials as opposed to verbalising. And also there's a lot of, almost inevitably, there's a lot of unconscious material that makes itself known when we make images or objects and then reflect on them. Next. Okay, so here are some pretty interesting, they're not from my clients because that wouldn't be ethical, but this is online images of some pretty typical art therapy work. So as you can see, it's pretty raw. It's also quite powerful. And the other thing is that the images and objects we create in art therapy, it's about the process, and you may look at what you've created and think, wow, that has some formal qualities that I really like, or you might just screw it up and put it in the bin. But the point is not that it has any formal or aesthetic qualities. Is that okay?
Yeah.
Yep.
Just activity.
Yeah, I am going to get them to do an activity. I'm a little bit informal with you, right? Because I know him quite well. Okay, so there's a lot of you here and you're all welcome to participate, but we're only going to spend 10 minutes max on this activity. So what I'm going to get you to do is...
I'm just going to divide this.
Okay. Oh, fantastic. Use whatever materials do the trick, and what I want you to do is just tune into yourself for a moment.
Yeah, that's over there.
And just reflect on how you're feeling, and if you were to give that feeling a colour and a shape, what would it be, and would you use a texture of an oil pastel or a chalk? Okay, so if you're willing to do that, that's wonderful. If not, that's great too. And what I always do during an art therapy session is I give this preamble. Yoat, could you stop moving around and talking? Thank you. So, as you're already aware, it's tempting to have a little chat, isn't it? Is that this is only a brief activity. Usually the art therapy session with a group lasts for about an hour. There's between 3 and 15 participants, not this many. And it's really important to have phones turned off, to not to disclose anything to do with sex, violence or abuse, because that can be triggering, or sex, violence, drugs, alcohol, because that can be triggering to other participants. And of course that also is a similarity with when you're in a tertiary context, that sort of content can be triggering. So if you do have content that's distressing, really good idea to get a mental health plan from your GP, get a referral to see a therapist. And in, of course, the hospital context, one-to-one art therapy sessions are available if people have content that needs to be processed in a different setting. Okay. And it's really tough not to judge yourself when you draw or paint or anything, so just totally suspend your judgment and be aware of when that judgment surfaces, and try not to give yourself a hard time or compare what you've created with what other people may have made. Really important to be kind to yourself. I can see some people drawing already, which is great. You've got just a minute to do a really quick drawing, a shape, a colour that represents how you feel. Okay, fantastic. So that's about a minute. So now, if we can have, say, 4 people who are happy to share their work. Can I have 4 people who are happy to...
Just put your hands up. All.
Yeah. Lovely. Great. People from the back, yeah.
There's magnets on the wall.
Okay.
Do you want me to put them up here, or we just...
No, I usually just hold them up. Okie doke. So, don't know which one is which. Okay, so this one, whose drawing is this? Okay, lovely. So, what's your name? Electra. Oh, what a gorgeous name, Electra. So this is Electra's image. Any thoughts about how Electra may have been feeling when she drew this? What do the colours and marks tell you about how she might be feeling? There's no right or wrong answer, by the way.
Being calm and in the flow.
Oh, okay. Thank you. Anyone else? Pardon?
Feeling wavy. Coasting along.
Coasting along. Did someone say wavy? That's nice. Yeah, great. So, Electra, does any of that reflect what you were feeling?
Yes, I think so.
Okay.
And, a softness.
Okay.
It's like water.
Yeah. The softness like the water, that's a beautiful. Okay, thank you. Okay. Okay, this one. Charlotte. Okay, Charlotte. So, first of all, we'll ask, can everyone see that clearly, this image? What do you feel? Stressed?
No, I'm not stressed. No.
Well, look, we'll get energetic. Okay. Anything else?
Busy head, thought, lots of thoughts.
Busy, lots of
These
thoughts.
are like frustrated or overstimulated.
Oh, frustrated or overstimulated. Okay, thank you for those responses. So, Charlotte.
I feel like it's a combination of everything everyone said.
Ah.
It's just, my brain is just going in so many different directions right now, but it's just
Okay.
all not like spiraling out of control,
Yes,
just
yes.
spiraling in together to
Okay.
make one.
Oh, that sounds like a fun thing for your brain to be doing. Thank you. Okay. Oh, I'm loving looking at these. Yes, Sarah. So, looking at this drawing of Sarah, how do you feel when you look at it, and what do you think might be going on for Sarah? A few minutes ago, at least.
Eye of the storm.
Eye of the storm. Okay. Anyone else?
It's quite playful, I think.
Hmm.
What emotion that would be.
Okay, not sure of the emotion. Any idea from anyone else what the emotion might be for Sarah?
Very in the head kind of thing.
Okay. Thank you. Thank you. So, Sarah, can you let us know?
I'm feeling very warm and tense, I think, as well.
Mm-hmm.
Quite like high energy, but quite concentrated into one space.
Okay. Warm, concentrated into one space. You can sort of feel the tension in there, can't you? Yeah. Okay. Thank you. So, this last image, who does it belong? Pardon?
Maylin.
Maislin?
Maylin.
Madeline?
No, May Lynn.
Thank you, Madeline. That's another great name. Bit tricky to pronounce, sorry. So, Madeline, don't say anything just yet. Would anyone else like to sort of be with Madeline's drawing for a little bit?
Maylin, is that how you drew it, or is it another direction? Because I think it makes a difference.
Yeah, that's better. Great. Okay.
Going fast.
Going fast. Okay. Anyone else?
A cocoon or a shelter.
A
Cocoon or a shelter.
a cocoon or a shelter. Mm. Anyone else? No?
Subdued.
Subdued. so, Madeline?
A place to hide.
A place to hide. Ah, okay. Madeline, I love that you're doing this with your husband. Okay, so would you like to?
I'm feeling a little bit sad today.
Okay.
But I'm feeling very sad.
Oh, so a little bit sad and also safe. It helps, always helps too. And in art therapy we do lots of psycho education and lots of soothing and how can we soothe ourselves, and this is a perfect way to soothe ourselves and focusing on our breathing when we need to. And I always have a table that has kinetic sand, Play-Doh, sort of fidget toys. Yeah, so often it's really soothing to have stuff, sensory stuff to soothe with. Okay.
Time for one more.
Absolutely. Thank you. That was very nice, assertive behaviour. So, this is so.
Ignore the text, that was just my notes.
Sure. Without the text, just the image.
Looks intense. Red and green.
Like frustration.
Frustration, intensity.
It kind of looks like you might have made a decision about something.
There's some interesting responses. Sorry, what was your name again?
Janice.
Janice. So Janice.
Well, I guess it's an experience of being burnt over the last week or two.
Okay.
There's growth out of that, you
Yes.
reflect, but it's still a sense of being censored.
Okay. Okay, so feeling a bit burnt and so lots of reflection.
Yeah,
Wow, lovely.
yeah, but there's growth out of everything.
There is. There is. Yeah. Thank you for that.
Thank you.
There you go. Okay. So you've had a little taster, you've dipped your toe in the experience of art therapy in a group context, and often too there's things like a group sort of resonance where similar themes or colours or images might come up, even though people haven't been really focusing on other people's work. When we're all together and focused, there's often that resonance that may well happen when you're at TAFE as well, or sharing a studio space with other people. Okay.
Next one.
Yep. Okay. Yeah, sort of mentioned that a little bit, that in art therapy we use metaphors and symbols to communicate. So there's a bit of a buffer. It's not absolutely literal, sometimes it is, but often it is more useful when we describe things in a more symbolic way. We feel a bit safer. And of course, the wonderful thing about art therapy is you can put an image away until you're ready to look at it, because it might feel great to get it out on the page and for it to be witnessed and validated. And you might also need to, as a client, put it away until you feel in a good, safe, grounded space so you can look at it and process it more, usually with a combination of more art making and talking. And I mentioned this before too, I think that whatever it is that you create, you might go home and put it in your journal, you might tear it into shreds, you might burn it, you might bury it. And primarily it's about your own experience and process. You're not making it with any viewer apart from the art therapist and possibly the other participants in the room. Yep. And this is another, the image. Oh.
Do you want the image again? So,
Yeah, it's a great image, isn't it? Okay, thank you. Yeah, so this is obviously a little bit more And the benefits, of course, of art therapy is it, as I've said before, and I don't think we can underestimate, it feels so good, doesn't it, to make stuff. And in terms of the therapeutic process, it feels good to move, because often when we have issues or difficulties, we feel stuck and it's hard to move or speak. So it's very physical, which is why I don't encourage people to use their tablet to draw on. It's much more therapeutic to use art materials and have some space. So art therapy uses focused psychological strategies, which some of you may be aware of or have benefited from, including behavioural therapy, dialectical behavioural therapy, problem solving, interpersonal, and polyvagal, where you tune into how your body's feeling and your nervous system. So it's all about soothing, calming, grounding. Okay. Yep. Thanks. Next. Yep. Okay. So you've just experienced this, the difference between art and art therapy. That it's about the process, and often I will have to remind clients, because we're so conditioned, if you remember school, the primary and high school experience, to say, oh, that looks beautiful, or I really like that, or you're so talented. It's almost automatic. So it's not about giving compliments, or even positive comments can be perceived as a judgment of good or bad. So what's really important in art therapy is what is being communicated. And is everyone familiar with Carl Jung? Yeah, some of you will be. So I just love what he says about transforming base metals into gold. And I think that art that's informed by aesthetics and history and theory and self-knowledge and discipline, it does that transforming. And then it makes it, that process of transformation and aestheticisation makes the artwork palatable to the viewer, so the viewer can actually engage with the work. Because if the work is too confronting, it can alienate the viewer. And I know that's a debatable one, so some of us may be aware of Mike Parr, performance artist. He was active since the 70s, who did that performance, which I remember seeing as a young student at La Trobe Uni, where he doesn't have an arm, he had a fake arm, he chopped it off, and of course people didn't know that it was a fake arm. I mean, it would not happen now because people, would be up in arms. That was a little joke. So some art can be incredibly confronting and really useful to have a bit of a trigger warning. There would be now with Mike Parr, an absolute trigger warning. Yeah. Next, yep. So these are some very well-known artists. Yep. So Frida Kahlo, of course, everyone is probably really familiar. She's been incredibly popularised in the past 40 years. So she had lots of skills and training, and they sort of coincided, her honing her skills coincided with appalling accidents, and she was the first woman to depict very specifically female experiences like miscarriage. And she did it in a way that, even though it's quite graphic. Her aesthetic skills, her skill as a painter also makes these images a real pleasure for most of us. It's always subjective to engage with. And Louise Bourgeois is also really interesting, and I just found out this morning, which many of you may know, she was also a mathematician. And in her 50s, when her husband conveniently died and left her lots of money, she then was... Pardon?
She loved him.
But also convenient. Yeah, I think you can have both. I think Elizabeth Gilbert, who wrote Eat, Pray, Love, Elizabeth Gilbert, when her partner died, her wife died, she was devastated, but she also said, well, this frees me up to do some things that I couldn't have done with her. Because she wasn't really an outdoorsy person, and I couldn't have done these treks with her that I can do on my own. So that sort of pragmatism, I think Louise Bourgeois was pretty pragmatic. She had lots of very Freudian psychoanalysis, which she didn't actually find very helpful. She seemed pretty cheerful. And she did work that was all, yeah, it was so Freudian. It's all about the body and early childhood relationships and difficulties. She looks pretty happy, doesn't she, up there?
She had her days.
She had her days.
According to her assistant, she had her days.
Yes, thank you. I'm sure she did, like we all do. And then, of course, Agnes Martian is, lots of people Agnes Martian enthusiasts. Yes. So she fascinatingly had a diagnosis of paranoid schizophrenia, which I'm not qualified to make a diagnosis of Agnes Martian. However, I don't think that was accurate because she was so functional, I think, and other possible diagnoses, but not paranoid schizophrenia. Very productive, taught at an art school, had friendships, relationships. And this is one of her later works. And mysticism, her work and her life was very informed by Zen Buddhism. So her work is sort of the opposite of this focus on the body and a specifically female experience. And one of the reasons I like her work is because her managing her mental health. We all have mental health to manage, and we're all sort of, there's a new awareness, I think, that it's important to attend to our mental wellness as much as we do to our physical wellness. That was a real priority for her, and it's almost the opposite of what you would expect from an artist with a mental illness like paranoid schizophrenia. It's not just really incredibly expressive and messy, that cliche. It's incredibly thoughtful and reflective and ordered and very process driven. This is some work of mine from a couple of years ago. So obviously this is one too. So I wear, like dress paintings, I wear them and keep working on them, wear them, see if they work, are they comfortable, does the paint rub off. Next one. Yep. Oh, in Myers. Oh, that's the inside of this dress because they're reversible, and I'm hoping to wear them inside out, and well, not only inside out but also upside down. I haven't quite got there yet. Next. And that's another dress from a few years ago. And they're all, yeah, and this is an exhibition from, gosh, a long time ago.
Gosh, yeah.
Mm-hmm. And this quilt's made out of recycled material. So I used to paint sort of big paintings.
So do
And
you see yourself as an artist or an art therapist when you're doing these?
an artist. It's a very different process.
Yeah.
Yeah, good
So
question,
it's not
thank you.
about
No,
the
no,
vomit.
it's not about the vomit on the page. No, not at all. There might be a seed of that to start with, but
Yeah.
like we all do, there's lots of, oh, that works, that doesn't, that little bit works, but the rest of it can just get recycled or whatever.
I like that question that you raised earlier about the question of the viewer, and that with that role of therapy, there is no viewer per se, it's yourself. So you're putting it away. So there's that nice question to sort of intersect, where does this work go, the purpose of what I'm making it for? Does it go here for me, or does it go there for outside? I think that's something that we forget to ask a lot. Sort of just keep.
Yeah, and untrained artists too have that. They may not be trained, but they certainly have in mind, I want this to be seen. I'm curious about how others interpret and respond. I want to share this. I want to be part of a community.
Those built-in affirmations that are very ingrained in us, to sort of keep continually to seek that.
Absolutely. Yeah.
Yeah, really interesting.
Thank you. Oh, there they are in the gallery space. And that at home. That's my at home dress. And I'm looking at something I'm in the process of making, figuring out whether, yeah.
So when you look at them, are they formal concerns or meaning? Where does meaning come into it? Does it come into it at all?
It does come into it, yeah. Meaning comes into it. Formal concerns of about colour and paint and texture and function comes into it. Caring about an audience and not caring about an audience. They're weighty, so they're like a weighted blanket. For anyone who's ever used a weighted blanket, it's often very soothing. Yeah.
But they're also what you talked about, mending, isn't it?
Oh yeah, that's really important, mending, because of course working with acutely unwell, so the clients I work with, major depression, anxiety, bipolar, schizophrenia, autism spectrum disorder, ADHD, sometimes they overlap, often they overlap in fact, adjustment disorder, postnatal depression, so lots of wounding, and we all have lots of wounding in our lives, don't we? Experiences, our wounds are part of our human experience.
Are you attempting to fix the wound, or are you just getting them to explore the wound, or get them to manage the wound?
Yeah, explore, identify wound if it's useful, soothe the wound. But in my personal work, I'm aware of that we're all, as human beings, wounded. Yeah. So.
Go back to some of these. The making and stitching.
And of course, the earth is wounded. So the green, and on this dress there's lots of green crosses because, earth and forests are wounded and need help. And stitching is and I also work with psychiatrists and nurses and doctors, so, it's the psychic wounds get stitched up, they get healed, they get opened, they get cleared, they almost inevitably leave scars, which are a sort of map, sometimes in our bodies, of our experiences, just like childbirth and ageing. So the body, that idea is the body as a sort of woundscape, a physical woundscape, a mental, emotional woundscape.
But in actual fact, Michelle, when she finds a hole in something, she's really happy that she gets to mend it.
Yeah.
So the dress is constantly changing.
Yeah.
It'll change maybe down the track that won't stay?
Yeah. So holes and mistakes are good.
Do you ever sell your dresses?
I haven't yet because they take so long to make that unless people wanted to pay quite a lot for them. So if people wanted a commission, then yeah, I would sell
So I'm
some.
kind of interested, in a sense, you're stepping away from your role as an art therapist, but you are informed, your practice is informed by your role as an art therapy. And I think there's a really interesting intersection to discuss, because it's not therapy for you when you do it, or maybe there's an element of it, but you are talking in a more distant manner about general wounding and things. And I think this is an interesting kind of when we're talking about the difference between art therapy and an art practice, that where you are informed by your life's experiences, but your practice is more considered and wants to speak to the viewer in... I'm rattling on, but I'm...
No, not at all.
But wants to speak to the viewer in a broader context.
Absolutely.
Yeah.
Absolutely.
Yeah.
So as you work with people who deal with trauma, and you said that most people deal with some sort of trauma. It can be, a big trauma or a small trauma. But how do you help people who actually, because here we are all trying to do creative work, and we all have, let's say, a background of trauma, because that's life. So how do you direct or help people to be in touch with their trauma, but also take a distance in order to find from which part of themselves will they be relying or drawing in order to create? Because I'm assuming that's what would be interesting for us to figure out.
Well, we do draw on our own experiences to create, don't we? And also our own experiences can include watching the news, our own relationships, looking at the work of other artists, listening to music, watching films, reading books. So all of that, and the desire to be creative, it takes different forms, doesn't it, for different people?
Yes.
Yeah, and for visual artists, of course, it tends to take a visual form. Some artists choose different mediums depending on what sort of work they want. An idea needs a particular medium, a particular idea needs a different medium. So with patients, it's that I think as humans, all of us have that desire to express in some form our feelings and our struggles, and to have them heard. So it's providing that space in a work context, in a therapeutic context. So as a student of visual art, I think it's pleasurable to make work. That's inherently therapeutic. It's calming, it's soothing, and you're informed by your other interests and knowledges as well as your visual arts skills. Does that a little
What
bit?
I had more in mind was whether you thought that a certain level of consciousness for the person that is creating is necessary in order to be able to differentiate between the aspect that needs to stay for within and what needs to be communicated.
So as an art student or an artist, yes, you do need to differentiate, and you may disguise it as well. You may talk about something really difficult, but you use some image or symbol, you develop your own language to talk about things, express things for yourself, and other people might read it on an intuitive level. It depends how much you want to disclose too, how much you want to invite the viewer in, how much you want to risk. Like Mike Parr's obviously very willing to risk people just taking one look and walking out the door. So you might use more symbolic visual language if you want people to, like Jenny Watson for example. She referencing quite difficult experiences without being overtly too explicit about them. So it depends what you're...
I think it's back to that point you made before about alienating the viewer and that sort of intersection of, is this art for me or is it for the viewer? And if it is for the viewer, how do we entice the viewer to look at it or walk away? So is it the Mike Parr approach or is it the Agnes Martin approach? Sort of there's all those different roads to consider, and
it is that spectrum, isn't it? It's like there's Angus here who could be in your lounge room, and then there's Frida who may or may not be in your lounge room.
But Louise Bourgeois also does it very effectively using actual tools as part of her work, like cutting tools and the needle, and to express the deeper...
Yeah, or that abject, traumatised stuff. She sort of indicates that she hints at it without...
I would like to ask that, since you meet so many people and you interact with their most difficult intimate problems, how do you make sure that you yourself don't internalize those problems? How do you remove them at the end of the day out of your system?
Well, that's part of my training as an art therapist and a social worker. I might go for a swim in the ocean at the end of the day, which is a really cleansing thing to do. I watch Beyond Creepy on YouTube, which is my favourite podcast.
Do you find that there's a crossover between you being an art therapist and an artist, that some things that you do maybe experience with your clients comes out in your own artwork?
Yeah, absolutely, absolutely. But it symbolically. Yeah, symbolically, yeah.
Is that part of that sort of cleansing process? Sort of to process?
Absolutely, it is, but I'm very aware, I know I'm processing this because this domestic violence keeps surfacing as an issue, and I know that I'm referencing it by doing this. I know that, but the viewer may get a feeling of that, maybe or maybe not, for example.
It's also recognising the therapeutic aspect of making.
Yes.
So, like myself, I recognise going to the studio, I benefited from it a lot. As artists, I think we do. So that place of being alone and so intense, it's a way of...
It's almost therapy for every artist, isn't it, doing your art?
Therapeutic.
Therapeutic, yeah.
Way of processing those things.
It's like a form of meditation, isn't it? Being alone with your work, having that dialogue with your work, which is sort of like an aspect of yourself. So there's that dialogue.
If that's any more questions?
Yep.
How similar is play therapy to art therapy?
It's really similar because play therapy, it's where you play. So often I was going to do a sort of version of a sand tray exercise with you guys today, but it would have taken too long. Art's like playing, isn't it? So play therapy, like in a sand tray, you'll choose, I might say to the client, so choose an object to represent your mum and your dad. And the person might choose a gorilla as their mum and a little frog as their dad, and they might be really far apart. And I was like, gosh, there's quite a big distance between the frog and the gorilla. So, yeah.
So if you were thinking about becoming an art therapist, what would you say is the best pathway to go? If it's not, you quite often see online there's lots of different art therapy courses, but then if you really want to work in a clinical situation or in, say, an acute sort of situation, what would be the best pathway towards that?
Well, in addition to having a qualification as an artist, so I had a qualification as an artist, then I did a Masters in Art Therapy when it was at Edith. Now it's moved to Murdoch. I think there's a diploma of creative therapies that you can do at Curtin. And then I did social work rather than psychology because I'm hopeless at maths and there's no way I could do stats. You could just pay someone to do the stats, I suppose. But I think, and also I did a registered mental health sort of training, and that's the ongoing training that I do. So I think you do have to be really well grounded in mental health.
Is that not a part of your...
It's part of, but my experience was that many of us also have degrees in social work or psychology or education. Psychology and social work I think are the most useful. Yeah, I don't think 2 years of a master's unless you have a background in social work or psychology is enough.
So you were going through TAFE and you went through into a fine arts degree, and then decided to do a postgraduate sort of qualification in art therapy, if it's possible.
Yeah.
Would that be enough, or do you feel that...
Not in a mental health setting, it wouldn't be. In other settings it might be, but not in a mental health setting. Yeah.
Well, thank you, Michelle.
Thank you very much.
My pleasure.